Welcome to a tutorial on the application of cocoheal biocellulose occlusive dressing for healing chronic wounds. Cocoheal is a patented, first-of-its-kind wound dressing developed through a biologic process. It is entirely natural and works on the principles of moist wound healing. Cocoheal is composed of 98% moisture and is incorporated with coconut-derived monolaurin for faster wound healing and skin regeneration. It acts like a temporary skin substitute and has been clinically proven to effectively heal a spectrum of chronic wound conditions. Cocoheal has superior properties that make it an ideal choice for chronic wound management. It is very versatile and can be applied for multiple wound conditions such as diabetic foot ulcer, first or second-degree burn, pressure ulcer, venous ulcer, or ischemic ulcer. It can also be used on acute wounds for accelerated healing with minimal scar formation. Cocoheal has one of the highest moisture holding capacity among dressings and helps maintain optimal moisture at the wound site for long duration, thereby aiding in accelerated wound healing. The high nanoporous structure of cocoheal acts like a selective barrier and helps prevent any secondary infection to the wound site. Cocoheal's high absorption capacity helps to absorb and retain mild exudates from the wound bed. The occlusive property of cocoheal helps in autolytic debridement of necrotic tissue from one site. It also helps in reducing edema and scar formation while reducing pain. Now let's explore the sizes in which cocoheal is available. Cocoheal is available in two sizes: 5 cm by 5 cm and 10 cm by 10 cm. Both these variants come in a non-sterile aluminum outer packing, inside which is a sterile transparent strip. There are 6 individually packed dressing per strip for the 5 cm by 5 cm dressing, and 1 dressing per strip of 10 cm by 10 cm. An instruction manual on application procedure can also be found within the aluminum pouch. Let's move on to the application procedure of cocoheal biocellulose occlusive wound dressing. Ensure to have these items besides cocoheal before proceeding to wound dressing procedure: surgical gloves, povidone iodine solution, saline solution, surgical cotton, sterile gauze, rubbing alcohol, clean measuring scale, surgical tape, scissors. Ensure that the wound dressing is being carried out in a clean environment. Always use sterile surgical gloves when handling a wound. Before preparing the wound for dressing, assess the wound type, presence of any infection, odor, etc. to ensure that the wound is in a treatable condition. Cocoheal is not advised for use on infected or highly exudating wounds. The wound has to be debrided of necrotic tissue and slew using standard debridement procedures. After debridement, clean the wound bed with cotton dipped in povidone iodine solution. Ensure that the peri-wound area is also cleaned. Irrigate the wound bed with saline solution for few seconds, and then utilize a cotton ball to pat the wound bed and peri-wound area dry. Measure the length and width of the wound using a clean scale to identify the dressing size required. Sanitize gloves with rubbing alcohol if required. Open the aluminum foil pack to extract the sterile transparent strip containing cocoheal dressing. Tear or cut open the sterile transparent pouch and extract cocoheal dressing. Place the dressing on the wound bed such that the dressing covers the entire wound and also at least up to 1 centimeter of the peri-wound area. If the dressing seems to be too big, it can be trimmed with surgical scissors to the required size. Ensure that the dressing is in full contact with the wound bed, without any air pockets by applying a gentle force on the dressing with 2 fingers in a motion that starts from center of the dressing and radiating to the edges. Either side of the dressing may be used. If required, a secondary dressing can be applied over cocoheal to ensure that it stays in place. For this, make a pad by folding a gauze cloth 3 to 4 times to a size that is slightly bigger than the applied cocoheal dressing. Place this gauze pad on cocoheal dressing and then secure it with few wraps of gauze or with surgical tape, whichever is convenient. Change the dressing every 2 to 3 days depending on exudate and moisture level maintained within the dressing. The procedure has to be repeated for every dressing change until full granulation is observed on one site. In case the wound is assessed to be a cavity wound, then cocoheal dressing can be trimmed to bits of 5 mm to 10 mm as required and filled within the cavity. Then a second untrimmed cocoheal dressing can be placed over the filling and secured with a secondary dressing. Repeat this procedure until the cavity size is observed to be reduced and cavity filling may no longer be required. Under certain circumstances, such as for dry wounds, cocoheal dressing may have provided all the moisture content to the wound bed and would have completely dried up after 3 days of continuous usage. Under such circumstances, the dressing can be rehydrated by saline irrigation until it is completely saturated and then removed easily from the wound. When using cocoheal for healing skin graft donor site, the standard application procedure can be followed. The dressing can be left in place without replacement until the granulation has completely occurred. Cocoheal biocellulose occlusive wound dressing is indicated for use on minor burn, radiation burns, dry to moderately exudating wounds such as cuts, pressure, ulcers, partial and full thickness, traumatic injuries, abrasions, skin graft donor site, and other skin breaks which are not showing signs of normal healing. It is also indicated for acute surgical wounds post-suture removal. Cocoheal is contraindicated for use on individuals with an allergy to monolaurin on third-degree burns to control heavy bleeding, infected wound, or wounds with heavy exudates.